Hello and welcome to our presentation, Reproductive Justice, Efficacy of STI Prevention Programs on Sexual Health Outcomes in Incarcerated Women.
This evidence-based brief was conducted by Cheyenne Damron, Lynsy Gianotti, and Bailey Strader under the guidance of the Carroll College Department of Nursing.
To examine the topic of reproductive justice, we looked at the question, among incarcerated women, how does participation in STI prevention programs compared to no participation in STI prevention programs affect sexual health outcomes? Incarcerated women continue to experience disproportionately high rates of sexually transmitted infections, STIs, than compared to that of the general population. According to Wiehe et al., 2015, test positivity rates for STIs among recently released female offenders is approximately 9.2%, as compared with the general population of female non-offenders at approximately 1.6%. This data presents a 7.6% disparity of STI positivity rates among female offenders as compared to female non-offenders. The background portion provides several definitions pertinent to understanding the question at hand, including incarcerated women, sexually transmitted infections, or STIs, sexual health, and STI prevention programs. STI prevention programs reviewed in the utilized studies implemented strategies ranging from education concerning self-advocacy and connections to social support systems, to safe sex practices and reductions of barriers to sexual health care access throughout communities. Sexual health care, from a holistic perspective, takes into consideration aspects beyond just physical health, by including psychological, emotional, and relational aspects as well. The middle section provides a brief overview of the 6 peer-reviewed research articles examined in attempts to answer our question.
The first article, Correlates of Retention in HIV Care After Release from Jail, Results from a Multi-Site Study, was a non-randomized prospective cohort study that showed significant positive associations between the enabling of jail and community-based resources and the likelihood of follow-up regardless of demographics. However, jailed women were still 50% less likely to remain in care than were their male counterparts, due to the multitude of disparities HIV-infected women face.
The second article, Efficacy of an Adapted HIV and Sexually Transmitted Infection Prevention Intervention for Incarcerated Women, a randomized control trial, was a randomized control trial that showed decreased participation in risky sexual behavior by women who participated in power intervention sessions, as evidenced by reports of fewer male sexual partners and less vaginal intercourse without a condom. The intervention subjects also reported fewer barriers to condom use, greater HIV knowledge, health protective communication, and tangible social support. There was not shown to be a decrease in the incidence of STIs.
The third article, Examination of an Interventionist-led HIV intervention among criminal justice-involved female prisoners, was a Phase 3 trial of a randomized intervention that suggests a positive association between the implementation of the RRR-HIV, or Reducing Risky Relationships HIV intervention, and a reduction of unhealthy characteristics of relationships, such as the spread of HIV and other STIs, condom use, and low self-worth.
The fourth article, Feasibility of an HIV STI Risk Reduction Program for Incarcerated Women who have experienced interpersonal violence, was an open, unblinded feasibility trial that found a significant decrease in the occurrence of unprotected sexual acts and both PTSD and depressive symptoms among intervention participants, as well as trends in improvement in the ability to self-advocate and obtain resources.
The fifth article, Positive Transitions, Post, Evaluation of an HIV Prevention Intervention for HIV-positive persons released from correctional facilities, was a randomized control trial that found the results of the research was inconclusive as the design did not allow for differences in specific primary outcomes related to reduced HIV risk behaviors and increase in healthcare service use to be analyzed.
The sixth article, Reducing HIV and Partner Violence Risk Among Women with Criminal Justice System Involvement, a randomized controlled trial of 2 motivational interviewing-based interventions, was a randomized controlled trial that found that MI, motivational interviewing, was successful in reducing the occurrences of unprotected sex among women with criminal justice involvement. However, no reduction in occurrences of interpersonal violence was found.
After critically appraising the articles and synthesizing the evidence, we made the following conclusions. Overall, participation in STI prevention programs by incarcerated women was found to decrease engagement in risky behavior and improve partner relationships through communication and education-focused interventions. Additional access to a community-based resource post-release was shown to further improve sexual health outcomes. Incarcerated women were found to be a target population at risk for poor sexual health outcomes. Thus, many of the most successful programs were adapted towards women in particular. To fully address the scope of the PICO question, additional research that allows for comparisons and generalizability among populations is warranted.
The direct application of the information presented throughout this brief into clinical nursing practice is crucial for continually upholding high standards of healthcare for all patients, no matter their background. Nurses, especially those who work in public health, as well as within the prison system, can use this information to implement practices of both advocacy and education in order to promote positive sexual health outcomes throughout the lifespan to a population that often goes overlooked, incarcerated women. Specifically, nurses working directly with incarcerated women can advocate for prevention programs to be implemented within the facilities serving this population to provide holistic patient care. However, to make these types of programs possible, nurses must also be willing to get involved in the legal system by writing policies and supporting legislation that allocates funding to allow for the implementation of STI prevention programs aimed towards targeting the unique needs of incarcerated women. Nurses can utilize the information from this systematic review to serve as a voice for incarcerated women in the overall movement of reproductive justice for all.
Thank you for listening.